Welcome to today's Practice Advantage Pearl. Today we'd like to discuss blog talking, some tips for blogging, and as you may know, I'm a relative rookie at this, so I'd like to pass along some of the things I've been learning about blog talking. One of the points is sharpening the focus. You shouldn't be boiling the ocean in a blog, and part of that focus is staying singular in your topic. Not easy for me to do sometimes. Second is knowing your audience. The audience typically is your patient population. How do you get to know the audience and their vernacular? You can ask your staff, you can ask the patients, but as you're blogging, remember that your audience may not be your colleagues as physicians, they may not be the insurance carriers, but instead the patients that you're serving. Clean speak. Be concise. I have a tendency to be a storyteller, and that old adage from Will Shakespeare kind of rings home for me. Brevity is the soul of wit. Keep it brief. Find your voice. And the next one is everybody has a voice, a writing voice, and find that voice and stick with it. That's your personal connection via writing with your audience, the patients. Next is don't forget about Webspeak. Some of the searchability criteria are baked into the vernacular that you're going to be using in that blog. Optimize the web search with that. Here's a great one for me. Enough is enough. There's usually that anecdotal thing or that next thing I want to talk about, and it's not that singular focus, so enough is enough. Read over your blog yourself. Read it again, and then cut to the chase. Don't be afraid of editing. Finally, have someone else read it over. Somebody that maybe is in that audience or somebody that could represent that audience. Finally, post it. The opportunity to really craft your voice, inform your patient population about some things that might be new. Maybe you've got new staff, maybe you've got a new kiosk for registration, you're making things easier. Valued information to help them make a decision about where they access their health care. And making it personal will be very important. So I would encourage you to go ahead with some simple things and start blog talking. Thank you for listening to today's Practice Advantage Pearl.